going to talk about the muscles of the back. Firstly, the trapezius. Its origin is medial one-third of the superior nuchal line. Insertion: upper fibers into the posterior border of the lateral one-third of the clavicle. Its nerve supply: spinal accessory nerve, that is 11th cranial nerve. Its action: upper fibers act with the levator scapulae and elevate the scapula as in shrugging. Upper fibers of both the sides extend the neck. Medial fibers act with rhomboids and retract the scapula. Upper and lower fibers act with serratus anterior and rotate the scapula forwards round the chest wall, thus playing an important role in abduction of the arm beyond 90 degrees. Steadies the scapula. Secondly, the latissimus dorsi. Its origin: posterior one-third of the outer lip of iliac crest. Its insertion: the muscle winds round the lower border of the teres major and forms the posterior fold of the axilla. Next muscle is levator scapulae. Its origin is the transfer processes of C1, C2, posterior tubercles of the transverse processes of C3, C4. Its insertion: superior angle and upper part of medial border of the scapula. Its nerve supply: a branch from dorsal scapular nerve, that is C5, branches from C3 and C4. Its action: helps in elevation of the scapula, steadies the scapula during movements of the arm. The next muscle is rhomboid major. Its origin is from lower part of ligamentum nuchae. Rhomboid minor. Its origin is from the lower part of ligamentum nuchae and spines C7 and T1. Its insertion: base of the triangular area at the root of the spine of the scapula. Rhomboid major. Its origin starts from spines of T2 to T5 and supraspinous ligaments. Medial border of scapula below the root of the spine. Supraspinatus muscle lies above the spine of the scapula and infraspinatus muscle lies below the spine of the scapula.